In today's video, we're talking all about colored contact lenses. I'm wearing theatrical contact lenses right now. I don't know if you could tell, but my eyes are hot pink. And today we're going to talk all about the different types of colored lenses and what to look for when you buy them. Welcome to Salisbury Eye Care and Eyewear. I'm Dr. D. My goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every Wednesday at 8 p.m. Hey, I'm Dr. D. I'm a doctor of optometry with my own private practice. I'm residency trained in ocular disease and I specialize in dry eye. On this channel, I post educational videos about eye health and vision products. If you're new here, do consider hitting that subscribe button and don't forget to hit the bell down below so you never miss a video. While you're at it, I've included some helpful show notes, and today there's a lot of really helpful ones because I've included all of my references from the FDA and regulations on colored contacts down below. So do check that out throughout the video. Today we're talking about colored lenses. We're going to talk about my concerns about colored contacts and what you should look for so that you're making sure you wear them in a healthy way and you don't harm your eyes for any Halloween festivities you might be going to or cosplay type of things you're doing. It's just really important to keep eye health at the forefront, and I'm going to help you do that today. All right, my pupils, it's time for eye school. Wah, 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 wah. Halloween edition. So there are several types of decorative lenses that change your eye color. Any lens that changes your eye color is considered a decorative lens, and these are regulated by the FDA. But there's a couple different types. So one of the types of colored lenses is just the type that changes your eye color kind of on a day-to-day basis. I've done a video about that type of lenses before. It's the Air Optics colors, and I'll go ahead and link that video right here so you can check it out. But that's definitely a different type of lens than what you see me wearing right now. Oh, you thought I just turned into a zombie. No, these are lenses. Yeah. Okay, good. Now that that's settled. The second type of contact lens is a theatrical or costume contact lens, and that's exactly what I'm wearing right now. This is a whole lot different than the type of contact that just simply changes your eye color for the day. The biggest difference lies in the oxygen permeability of the lenses. So the cornea, where your contact lens sits, is an avascular structure made of collagen. The cornea actually gets its oxygen supply from atmospheric oxygen. That means that your eyes are truly the healthiest without any contact lenses in the way. When a contact lens is on your eye, it's truly a medical device and it's a barrier to oxygen. So the best case scenario is to not have contacts in at all. That's how your eye breathes the best. When you put contact lenses in your eye, no matter what, it's a barrier to that oxygen. The lenses you see me wear in every other video, those lenses have a dK/T of 100. dK/T is industry speak for the breathability of the lens, and every single contact lens out there is assigned a breathability number. That number is based upon the lens's breathability at -3.0. That's really important because if your prescription is much higher than a -3 or lower, or let's say you're a plus prescription instead of minus, your breathability index will actually be different than what you see on the packaging. So my day-to-day wear lenses are a dK/T of 100, and they're daily. That's pretty normal. Air Optics colors, which I showed you in that prior video and which I just mentioned as being one of the options to change your change your eye color every day with contacts, those are a dK/T of 138. I tell my patients a dK/T of 200 is like having nothing in the eye at all, and a dK/T of 0 is like, having something like this cardboard box in your eye that's just not breathable at all. The lenses I'm wearing right now, these theatrical or costume contact lenses, their dK/T is 9. Single digits. It's made of polymacon, and it's an old material. They're hydrogel lenses, and they are not breathable at all. The big advantage of Air Optics lenses that just change your eye color on a day-to-day basis is that they're made of silicone hydrogel. Adding silicone to a lens makes it so much more breathable than just having hydrogel. And these bad boys are just hydrogel, so they're not very breathable at all. This is not a lens that I would recommend wearing for long periods of time or on a daily basis. But for fun, for a video like this, for a special effect, for a Halloween party, sure, you can wear these safely. And I'm gonna tell you how. Okay, so here's a fun fact. The first corneal ulcer I ever saw was from colored contact lenses that came from a wig shop. They were actually illegally sold because per the FDA, you must have a doctor's prescription from a valid eye doctor that's within the last year to purchase contact lenses. And the person you buy from has to ask for that prescription. So that's a huge red flag. If you go somewhere that's just selling you contact lenses and not asking any questions about prescription, if they fulfill that, you can actually, and you should actually, report them to the FDA because that's an illegal sale of contact lenses. And I'm very passionate about that because my first patient who ever had a devastating corneal ulcer was 16 years old, didn't know better, got costume contacts from a wig shop and had no instruction on how to care for lenses, how to use them, and that's what led to her having such a devastating corneal ulcer. So these things do happen, and I want to give you the tools to make sure you are safe in contacts. So here's who you should never ever buy from: street vendors, wig shops, beauty parlors, flea markets, novelty stores, Halloween stores, and be very, very cautious of your online vendors. Make sure that they're reputable and that they're asking you for that valid prescription. So here's the risks associated with wearing contact lenses that may be expired or are otherwise just not cleared by the FDA. Number 1 would be a corneal abrasion, so a scratch on the surface of your eye. Another one would be corneal hypoxia. Imagine a material so dense that your eye can't breathe and your cornea starts to swell because of it. That actually happens in lenses that are not very breathable. The third is you could have an allergic reaction. Your eyes could become red and swollen and watery, all from these contact lenses, the material they're made of, and the solution they're stored in. Decreased vision is another concern. With corneal hypoxia and allergy and corneal abrasions comes a reduction in your vision. These things can also lead to infection and blindness. I'm going to show you some pictures of corneal ulcers that will make you scream. Remember, if who you're buying contacts from doesn't ask you for an RX, a location, and a phone number, they could be breaking federal law and they could be reported for the illegal sale of contact lenses. Here's my tips for better eye health if you want to wear colored contact lenses. Number 1, have an updated prescription, and that means having an updated exam. Yeah, I'm super biased, but I'm an eye doctor and my job is to give you tips that are going to make you have better eye health. And having an updated eye exam ensures that we've looked at your eyes, we've evaluated them front to back, and okayed you for contact lens wear. So don't skip that step. It's truly the most important one. The second, always buy from a reputable source. Really avoid buying your contact lenses, tempting as it might be, from a flea market or other untrustworthy vendor. My next tip, never overwear your contact lenses. This is always important, but never is it more important than when you're wearing a contact lens whose DK over T is 9. It is so critical not to sleep in these lenses. Limit your wear time, try and keep it, if you're going to a Halloween party, just wear it for those 6 or 8 hours instead of wearing it all day. That'll really help your eyes feel a lot better. My next tip is to always follow Dr. D's care instructions. I'm actually making an entire video about this coming up. When I have it available, I'll link it here and put it in the description down below, but look for that video coming up. In short, I want you getting your lenses out every night, cleaning them, rubbing them with solution, fresh solution every day, clean that case, just really be hygienic and clean with your contact lenses, and that makes all the difference in your eye health and how your contact lenses wear. Seek help immediately if you have symptoms of RSVP. RSVP is my clinical shorthand for redness, sensitivity to light, vision changes, or pain. Any of those 4 symptoms are happening for you, get yourself to an eye doctor so they can assess what's wrong. Never, ever, 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 ever share your lenses with any of your friends. As tempting as it might be, if you're a werewolf this year, and they're going to be a werewolf next month, do not share those lenses. Which brings me to the point that keep in mind that as soon as you open the contact lens vial, the timer starts. So even if the lens is made monthly for monthly wear, it's not 30 separate individual wears over the course of 5 years. It's literally 30 days. So once you open the case, the timer starts. Make sure to keep your wear time short and never, ever sleep in these lenses. Does anything look different about me from when we started this video? I just feel a little different. I felt different kind of going through, I don't know, maybe it's just me. Today, we covered colored contact lenses, and that includes both the kind that you wear every day and then your more cosplay, costume, Halloween specific contact lenses. And I've had a lot of fun trying them on, and I encourage you to definitely ask your eye doctor about prescribing you some this Halloween. If you're in my area and you want to have an eye exam with me because you want this type of lenses, we can actually get them for you. So please make an appointment and come talk to me about them. As always, remember that hygiene around your eyes is the most important thing in terms of keeping them healthy. So clean your lenses, don't overwear them, never ever sleep in them, and you'll be very successful in wearing costume contacts as well. Have a very happy and safe Halloween. Thank you for tuning into our video today. We make videos every single Wednesday at 8 p.m., so tune in for those, and I will see you next time.